Imagine sitting at home, sipping your morning coffee, when suddenly your arm feels heavy, your words start slurring, or your vision blurs for just a few seconds. Most people ignore these early signs, thinking they'll pass, but those few seconds could mean the difference between life and death. A stroke doesn't always hit like a lightning bolt. Sometimes it starts quietly, but if you know what to do in that exact moment, you can interrupt it before it destroys the brain. This is not about medical miracles. It's about awareness, action, and timing. Every second counts, and knowing what to do can literally save your brain. The first step is recognition. When a stroke begins, the brain is crying for oxygen. A blood clot or rupture stops the flow of blood to certain areas, and within minutes, brain cells start dying. But before complete shutdown, the body often gives subtle signals: a drooping face, a weak arm, sudden confusion, dizziness, or trouble speaking. Many people shrug it off, thinking it's fatigue or low sugar. But the brain doesn't whisper without reason. If you feel any of these signs, don't wait. This is your window, usually a few minutes, to act before irreversible damage begins. Here's what you can do immediately. If you're alone, sit down safely to prevent a fall. Take a deep breath and focus. Panic is your worst enemy right now. The goal is to restore circulation and oxygen flow. First, loosen anything tight around your neck: collars, ties, or scarves. Oxygen flow must not be restricted. Next, try to take slow, deep breaths. Inhale through the nose for 4 seconds, hold for 2, exhale through the mouth for 4. This helps oxygenate the blood and stabilize your nervous system. It sounds simple, but it can slow the brain's deterioration while you wait for help. Now here's where most people make a fatal mistake. They wait to see if it passes. Don't. Even if the symptoms fade, it could be a transient ischemic attack, or TIA, known as a mini-stroke. It's your body's alarm system warning that a major stroke could happen within hours. So the second step is to call for help immediately. If you're alone, use voice commands to call emergency services or a family member. If you're with someone, ask them to record the time the symptoms started. This detail helps doctors decide what treatment to give. Remember this phrase: time lost is brain lost. The faster you act, the better your chance of recovery. While waiting for help, here's a little-known trick that may help keep blood flowing to the brain. Gently massage your earlobes, temples, and the back of your neck. This can increase blood circulation slightly and may help reduce the severity of the clot's impact. Another method shared by some emergency doctors is to stay upright and avoid lying flat. Sitting upright helps prevent blood pressure spikes that can worsen the clot or bleeding. Never take aspirin if you don't know what kind of stroke it is. If it's a bleeding stroke, aspirin can make it worse. Only take it if you've had previous doctor approval. Hydration also matters. If you're able to swallow safely, take small sips of water. Dehydration thickens the blood and increases clotting risk. Water helps thin it slightly and supports oxygen delivery. But if swallowing is difficult or you feel choking sensations, stop immediately. It could indicate muscle weakness in the throat, and forcing water could lead to aspiration. This is why staying calm and alert is crucial. A clear mind saves lives in moments like this. Now let's talk about prevention, because the real way to interrupt a stroke starts long before symptoms appear. The brain thrives on stable blood flow and oxygen. The enemies are high blood pressure, high sugar, and inflammation. Every time you eat processed food, smoke, or skip sleep, you add fuel to the fire that triggers clots. But here's the empowering truth: 80% of strokes are preventable. You can change the odds drastically by making small, consistent changes. Start by walking 30 minutes a day. It boosts circulation, lowers blood pressure, and strengthens your arteries. Add foods rich in omega-3s like salmon, walnuts, or flaxseed to reduce inflammation and prevent plaque buildup. Drink enough water daily and manage your stress because cortisol, the stress hormone, is known to constrict blood vessels. Another simple trick: practice deep breathing or meditation every morning. It lowers blood pressure naturally and keeps the brain oxygenated. Remember, strokes often occur early in the morning when blood pressure surges after waking. Starting your day with calm breathing can stabilize that spike and protect your brain. Now let's imagine you witness someone having a stroke. What do? Stay composed. Don't try to give them food, drinks, or medicine. Instead, use the FAST method. F stands for face. Ask them to smile. If one side droops, that's a red flag. A stands for arm. Ask them to lift both arms. If one drifts down, that's another sign. S stands for speech. Ask them to repeat a simple phrase. If their words are slurred or strange, time to act. T stands for time. Call emergency services immediately. Every minute can save 2 million brain cells. That's how urgent it is. Here's something most people don't realize. After the first few minutes of a stroke, brain tissue begins to die, but surrounding areas can still be saved through rapid oxygen restoration. This area is called the penumbra. Acting quickly, breathing properly, and staying calm gives doctors a larger window to save that part of the brain. It's the difference between full recovery and lifelong disability. When help arrives, provide them all the details: the time it started, the symptoms, any medication taken, and whether the person has diabetes, high blood pressure, or heart disease. This helps medical teams administer clot-busting drugs like TPA if it's an ischemic stroke. But here's the catch: it must be done within 3 to 4.5 hours. After that, it's often too late. That's why your awareness and speed matter more than anything. Think of your brain like the control tower of your life. It manages memory, movement, speech, and identity. A stroke can erase it all in moments, but it doesn't have to. By staying informed, acting fast, and keeping your body healthy, you can interrupt the process before it becomes catastrophic. You don't need to be a doctor to save a brain. You just need to recognize the signs and act with purpose. So remember this: when something feels off, when your body sends strange signals, don't ignore them. It's not just fatigue or old age. It might be the brain's cry for help. And in that moment, your calm, your quick action, and your breath can make all the difference. Take care of your brain. It's the only one you've got. And every heartbeat, every breath, every mindful choice you make keeps it alive, sharp, and thriving. You have more power than you think. Use it before it's too late.